Hello, everyone. My name is Dr. Vinay Mahendra, and I'm a senior consultant urologist at Apollo Gleneagles Hospital, Calcutta. I have been working here since 2003, and one of my special areas of interest has been a kidney transplant and use of minimally invasive surgery, laparoscopic and robotic surgery to give a better quality services to these patients who have a very prolonged suffering. Uh, Recent advances in the surgery of renal transplant is something which is dear to me. And that is something I would like to talk briefly about to make people aware as to what are the new methods by which the surgery of kidney transplant can be done. See, the renal transplant involves surgery on two people. One is a person who is donating the kidney, and the other is a person who is getting the kidney. So the person who is donating the kidney will be addressed as the donor, and the person who is receiving the kidney will be addressed as a recipient, and whatever I say from here on. Now, donors, it's a unique surgery in a way that the donor is not a patient. Donor is a normal, healthy person who is donating kidney as an altruistic measure for the benefit of the health of a person with kidney failure. So we have to be extra careful in doing the transplant because of involvement of a healthy person. Now, earlier, the surgery of removal of kidney from the donor used to be done by making a big cut. The surgery will involve a longer time. The donor will have to stay in the hospital for a long period of time. And the recovery, improvement from the pain, getting back to the work would take a very long time for the person to do that. With the technological advances, as the laparoscopic surgery came into urology in 90s, is the time, over a period of time, by end 90s, the donor surgery was started with a laparoscope. What is a laparoscopic surgery? Making small holes in the abdomen and then doing the full surgery of removal of the kidney laparoscopically by instruments being put from outside. And the kidney would be removed by a small cut, which would be about 2 inches, 2.5 inches long in the lower abdomen, and which will help the donor to recover a lot faster. The hospital stay would be much shorter, and people are able to get back to their normal work in about 2 weeks after the surgery has been done. And this is done without any compromise to the safety for the donor and for the result of the kidney function for the recipient as well. So laparoscopic surgery from late 90s to early 2000 gradually started to become popular and has become a norm and as a gold standard way to do the donor kidney removal for a transplant today. Now, with the laparoscopic advances happening even further, you must have heard about the thing called as a robotic surgery. Now, robotic surgery was also taken in doing the donor kidney removal. What is the difference between the robotic surgery and the laparoscopic surgery? The robotic surgery basically is nothing but an advanced laparoscopic surgery, but makes it more versatile because the instruments are a lot more advanced. They can be moved in many different angles, which is not possible with a laparoscope. And the robotic camera gives the benefit of a magnified 3-dimensional vision of the donor's abdomen, hence making it more realistic while operating on the donor kidney. As the donor kidney quality of surgery ultimately determines what the result the recipient is going to get, the robotic surgery has helped in doing those surgeries because the donor surgery is very challenging in many of the patients because of the anatomy of the blood vessels. So robotic surgery has been one of the latest advances in doing the donor kidney removal surgery. The overall recovery of the patient is not very different compared to with the laparoscopic surgery after the surgery has been done, but the intraoperative surgical procedure becomes a lot more simpler by using robotic assisted laparoscopic surgery rather than just simple laparoscopic surgery. Now coming to the recipient. Now the recipient, generally the kidney is put in the lower abdomen. If it is the first transplant, the kidney is put in the right lower abdomen. If it is the second transplant, kidney is put on the left side in the lower abdomen. And it involves a big cut. It involves a cut of about 8 to 10 inches to be able to create enough space inside the recipient so that the kidney can be put in. The blood vessels can be joined to the recipient's blood vessel to restore the blood supply to the organ, thereby helping the kidney to work normally. Now, conventionally, the recipient surgery has been done until recently by a big open cut. With the advent of the robotic surgery, now the benefit of robotic surgery can be used in doing the recipient surgery, meaning by making a very small hole to put the kidney, which has been removed from the donor, into the recipient's abdomen, and all the joining of the artery, vein, and the tube that drains the urine into the bladder can be done without having to make a big cut in a recipient. Now, this is a huge advantage because it avoids a lot of complications related to a big open cut, like wound infection, dehiscence of the wound in which the stitches may not heal up, and this all can happen because of the immunosuppressive medications that are being given to the recipient. Also, it avoids post-operative complications which can occur, like formation of a lymphocele. Lymphocele is a fluid accumulation which can occur because of leakage of a fluid called lymph. And that occurs because of extensive dissection involved to create the space to put the kidney. So lymphocele is totally avoided by doing the robotic surgery. Also, delayed formation of big hernias which may require major surgeries can also be avoided. Overall hospital stay on an average after an open kidney transplant is about 10 to 14 days. However, with the help of the robotic surgeries, majority of patients are able to get ready to go home within 4 or 5 days' time. The robotic surgery in the last 8 to 10 years, many studies have shown that there is no compromise in the graft function and overall result for the recipient, and at the same time avoiding big complications of the open surgery, as I have already mentioned earlier. Now, how the robotic surgery is done. We have talked about this. Robot doesn't do anything. The system uses a Da Vinci system, and in which there are two components. One is a component in which the robotic instruments are attached to the robotic tower, and this robotic tower is attached by a cable to a computer console where the surgeon sits and controls the camera and all the instruments to do the surgery inside the patient's abdomen. I think this, over a period of time, is going to become the gold standard for doing the kidney transplant surgery as and when the technology becomes more and more available. It is a promising thing. Not many centers are doing it right now, and it involves a huge learning curve, but it has been demonstrated in many studies to be a very safe, effective, good measure with a benefit to the recipient without compromising the safety for the donor and the recipient both. Thank you.